Hello everyone. I am Dr. Rahul Kanjilal, consultant nephrologist at Health World Durgapur. I have been practicing nephrology for more than 10 years now, and the topic I'm going to speak today is a very common topic. Is I have specifically chosen this topic because I feel that every patient of mine goes through this symptom at one time or the other. So the topic is pedal edema or swelling of your legs. Is it an indicator of your kidney disease? So the topic is simple. So let's start with what is pedal edema. Pedal edema is swelling of your legs. Legs mostly starts from your legs and can extend to your whole body. To understand the basic physiology, why is there swelling, is the interplay of three forces. So there is leakage of water from the blood compartment, the vascular compartment, the blood to the extracellular fluid. That's edema. The forces, there are one force is a force which tries to contain the water in the blood. There is one force which is trying to send the water out of the compartment, the vascular compartment, and there is a third force which is trying to remove that excess water if it accumulates in the ECF or the extracellular fluid. Now, the force which tries to hold the water is the albumin, is your protein. The force which is trying to remove the water from the vascular compartment is the overall vascular pressure. And the force which is trying to remove the extra fluid, if it is in the extracellular fluid, is the lymphatics. So, depending on three forces, the etiology of the pulmonary edema, the pedal edema varies. Now, to just classify pedal edema, first of all, there can be pedal edema in pedal edema means swelling of the legs. It can be unilateral or bilateral. So you have a swelling in one leg or you have swelling in both legs. If you have swelling in one leg, it is usually due to some local pathology. It might be cellulitis, must be some vein thrombosis, that is deep vein thrombosis. If it is, but at the same time, if there is systemic disorders, sometimes systemic disorders might present with unilateral edema, but it is sometimes. Usually, unilateral pedal edema is because of local pathology, and bilateral pedal edema is usually because of systemic pathology. Systemic pathology means the problem is in the whole system. It's not a local pathology. So, what are the systems or what are the causes of bilateral pedal edema? It can be your heart, it can be your liver, it can be your kidneys. In both, a kidney functioning less or excreting more of protein. It can be thyroid, can be anemia, to name a few. Now, there are two types of pedal edema. One is pitting and one is non-pitting. So, pitting means there is a dent. If you press your finger against that edema, there will be a dent. So, that's a pedal edema, pitting pedal edema. And if there's no dent, there is a non-pitting pedal edema. So, non-pitting pedal edema have got very few examples. It is usually because of lymphedema. That is what you get in filariasis, long-standing filariasis. Otherwise, most of them are pitting pedal edema. The second most important, the third most important importance, one is unilateral versus bilateral, one is pitting versus non-pitting, and the third important point is your painful and painless. So if it is painful, it is mostly due to some systemic or local pathology. For example, either your cellulitis or your deep vein thrombosis. Systemic causes bilateral pitting pedal edema are usually painless. So now coming to what are the kidney problems that might produce your pedal edema. So pedal edema due to kidney problems can be because of two reasons. First, your kidneys are functioning less. Second, your kidneys are excreting excess amount of protein. Now, as I told you, the force which is trying to hold the water in the vascular compartment is protein. So if the protein is excreted, the protein level in the blood decreases, the force which is trying to hold the water in the vascular compartment decreases, and hence the water extravasates. On the other hand, if your kidneys are functioning less, there is a tendency to fluid accumulation in the body. With the fluid accumulation in the body, the hydrostatic pressure across the capillaries increases. That forces the water to extravasate into the extracellular fluid. So that's the two main pathologies as to why there is pedal edema in a CKD or a kidney patient. Now coming to you have a pedal edema, you have a pedal edema. So what do you do? I would suggest always consult a physician or a nephrologist or a cardiologist, at least meet a doctor. Sometimes we have seen that there are some medicines which cause pedal edema. Specifically, to name a few, is like amlodipine. Amlodipin's side effect is pedal edema, and most of the time, general population tends to give you advice, and you just change the medicine, and then the edema decreases a bit, but it stays, and then you feel that this is most likely because of the drug, and you ignore it, and then further it aggravates. So therefore, whenever you have pedal edema, irrespective of how severe or how mild it is, please consult a doctor. So once you visit a doctor, we nephrologists, we can evaluate kidney function based on two very simple tests. One is your serum creatinine and the other is your urine routine. So these are the two tests which we usually start with. And fortunately, these tests are such tests that are available widely across almost every labs. All labs do this simple test. So coming to the tests one by one. Now to start with serum creatinine. So the biological reference range is usually specified in the report that you get, because it might vary from lab to lab. But overall, if you speak, a value of more than 1.2 is significant, considered significant, until and unless otherwise it is proved that it might be borderline raised. So the more the serum creatinine is, the less are your kidneys functioning. So this is an indicator as to how much your kidney is functioning. But do remember, serum creatinine is a very late marker of kidney dysfunction. So we have other markers also that we tend to use in our clinical practice, which helps to detect a kidney disease at an early stage. The second most important test which we were mentioning was the urine routine. So in the urine routine, apart from your active sediments, that is your cells and cast, what we pay importance or we pay attention to is the protein level. So the urine routine will tell you a semi-quantitative or a qualitative, rather a qualitative value of protein in your urine. Either it is present or absent, and if it is present, as to how much, what is the degree, though it is not very sensitive as to the level of proteinuria, but you have a 1 plus, 2 plus, 3 plus, and 4 plus, depending on the protein concentration in your that random sample. So once we have a raised creatinine or protein in your urine or both of them, we need to further evaluate the patient as to can these be the cause of pedal edema. So once you're sure that you have a raised creatinine, the second step is to estimate your GFR. That will give you a better idea as to what your kidneys are functioning as of now. And the protein level needs to be quantified with the help of either a protein creatinine ratio or a 24 hours urine protein. 24 hours urine protein is considered to be the gold standard, or as to the best estimation of your quantitative protein level. Once we have done that, we then further evaluate the patient as to the overall kidney function with the help of other tests. So once you have understood that is this pedal edema because of your kidneys, so next step is to manage this pedal edema. If it is because of your decreased kidney function, there are three important things that we need to remember. One is salt and fluid retention, and the third is diuretics. So diuretics are medicines which help to increase your urine output and hence tend to make you or try to make you euvolemic. Fluid and salt restriction is very important because without these two things, your diuretics won't act. And if it is because of proteinuria, then you need to have some amount of protein, extra amount of protein along with your other medications. So on that note, it's a very vast topic, but I have tried to get a synopsis of it so that in simple language you can understand as to why there is pedal edema and what are the causes of pedal edema And if it is a renal cause, then what are the types of renal dysfunctions that you have pedal edema? And if you have a renal pedal edema, a pedal edema because of your renal cause, then how do you manage it? So on that note, thank you.